Good afternoon, everyone. I'm Joy, and today I'm going to talk about thyroid cancer. I chose this topic because my mom was diagnosed with thyroid cancer when I was in elementary school, and it triggered me to choose pharmaceutical science as my major. So today I'm going to tell you what thyroid cancer is, how it's diagnosed, and treatment option available. So, thyroid is a small butterfly shaped gland located at the base of your neck, and thyroid cancer occurs when malignant cells form tissue in thyroid glands. And globally, it is increasing, especially for papillary thyroid cancer, and women are 3 times more likely to get thyroid cancer. Also, it is often diagnosed with people aged between 45 to 64. Risk factor includes exposure to radiation, especially during early age, and family history of thyroid cancer or genetic conditions like MEN2 syndrome. So there are 4 different types of thyroid cancer. Firstly, papillary cancer is most common type and it grows slowly and generally it has good prognosis. It spreads to regional lymphic nodes, so it is less likely to metastasize to other organs. Next one is follicle thyroid cancer. It is less common and it tends to invade your blood vessel. As a result, it often spreads through bloodstream to other organ. When the overall survivor rate is high, it is difficult to treat when it is spread to lung or bone. Third one is medullary thyroid cancer. It counts for 5%, and among them, more than 40% are hereditary. This arises from the C cell of thyroid that produce hormone calcitonin, and this calcitonin level is used to diagnose medullary thyroid cancer. Finally, anaplastic is the most aggressive and least common type. This cancer grows rapidly and often invades other organs like trachea or esophagus and neck muscle. This type is often diagnosed at very advanced age, which means by the time it is detected, it is usually already metastasized, making surgery very difficult and survivor rate very low. So here are some symptoms that you have to be aware of. Swallowing or lump in the neck, or feeling difficulty of swelling or breathing, hoarseness and voice change is a symptom that you have to be aware of. For diagnosis, a doctor perform a physical exam to check the lumps or swelling in the neck. If something suspicious is found, an ultrasound is usually the next step, and imaging can help determine the size and nature of thyroid nodule. If nodule looks concerning, a fine needle aspiration biopsy can be done to examine under a microscope for cancer cells. And once thyroid cancer is determined, staging is done to determine how far it has spread. So treatment depends on the type and stage of thyroid cancer. Firstly, surgery is the most common treatment to remove part or all of thyroid gland. And radioactive ion therapy can be performed to papillary or follicle cancer to remove any remaining cancer cells. Also, radiation therapy can be done for anaplastic thyroid cancer, and hormone therapy is used after the surgery to replace the thyroid hormone that patient cannot produce anymore. So lastly, before I go, let me tell you some steps to reduce the risk. Firstly, avoid unnecessary radiation exposure, especially during childhood, is important. And for individuals with family history, needs to take genetic testing regularly because early detection always saves life. Regular neck exam or ultrasound can help detecting thyroid nodule before it becomes problematic. Thank you for listening.